And we have Dr. Erica on the line this morning from St. Vincent Healthcare, and she is here to tell us why it is so important to get your flu shot this year. So good morning, Dr. Erica, and tell us, what are the takeaway points that we should walk away with after listening to you this morning?
We're cutting in and out a little bit, but I have my first take-home points that I would like to cover is just the usual reminders that influenza is a respiratory infection. It's not a stomach bug. A lot of times people get confused that the flu shot will help protect them from what they refer to as the stomach flu. And influenza and the flu shot only protect you against the respiratory influenza. You can't get the flu from the flu shot, and the flu shot will not make you more at risk of getting COVID-19 infection or other respiratory infections. But what makes this year a little more interesting in the current situation is that we are going to have COVID-19 virus circulating with the influenza virus this season, which makes it a little more complicated since currently we are at capacity or near capacity in our hospitals and ICUs here in Yellowstone County and throughout the rest of the state. And if we have a surge of influenza cases that need hospitalization, it's going to get a little tricky. So the influenza cases could potentially overload this already fine balance that we have, overextended balance, I should say. Also, one concern that I have is patients who've had COVID-19 already seem to have a slow recovery, some of them, and their lungs are not great. And if they were to get influenza on top of that, I worry about the severity of that illness, or if people get both infections simultaneously. We don't have a vaccine for COVID-19, but we do have a safe seasonal flu vaccine, which is the good news, and that's why people should get it this year. I have a few graphics. I'm not sure if I'm coming through because I think there's some technical difficulties, but I'll keep going.
Yeah,
Oh,
go for it.
Perfect. Okay, so here's the United States map, and you can just see, I think a lot of people know that up here in this tri-state area with Montana, North Dakota, South Dakota, we are hot right now. We are the hottest areas in the country in terms of infections per capita. My next slide shows Montana and the different counties, and this is per capita, so some of these smaller counties that have been hit are going to be up at the top. So you can see Toole County's at the top, and Yellowstone's down at about 17 cases per 100,000 people recently. And then my next slide shows just how Yellowstone County, Montana has shot up into the critical range with the COVID-19 infections. Starting in about September, we went from the orange high up into the red, and you can just see where we have rocketed into that. And my next slide shows the ICU beds. So here in Yellowstone County, you can see that we have already in August and September and into October been sitting right at the critical range in terms of amount of ICU beds that are being filled with COVID patients as well as non-COVID patients. So you can only imagine if we see a big surge of influenza like we have in other years, how that we're already almost overloaded, and we need to do everything we can to help prevent flu from being severe as well. My next slide quickly just shows so far this year the seasonal baselines from past years of influenza. You can see 2008 did go over the epidemic threshold with influenza alone, but when we get down here to 2020 on the far right, we're already way above the epidemic threshold with just COVID cases, and we haven't even started to see flu yet. So finally, the last couple of slides here. One is the burden of flu in last year. Had 400,000 hospitalizations and 22,000 flu deaths with 38 million people infected with the flu. But the final slide here shows that the benefits of flu vaccination last year showed that it probably saved about 105,000 hospitalizations by the only 52% of America that got the flu shot last year, and saved probably 6,300 deaths. So I think we can do a lot better than 52% of the US population getting the flu shot. And doing that will, number one, keep everybody safe, as well as really help out with our healthcare resources so that everybody who needs hospitalization for COVID-19, for influenza, or for any other problem is going to be able to have the care that they need without overloading the healthcare system.
All right. Well, Dr. Erica, thank you so much for your time this morning. We appreciate it, and we will see you next time. Thank you so much.
Thank you. Right. You're welcome. Thank you.
We'll be right back after the break.